Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another episode of my pop series. Today we're talking about sedation in dentistry, the different types of sedation that some of you might need to get over the level of anxiety or the level of nervousness that you guys come in with in order to get your treatment done, in order to get healthy. So depending on the arrangement of the practice or the dental clinic that you guys belong to, and I'm not going to go over the licensing and the logistics of it, but typically you have 3 different sedation that you can request or check with the office whether they offer it or not. The first type of sedation is just taking Valium. It's basically 5 or 10 milligrams of Valium, alprazolam, or diazepam. Valium comes for 5 and 10 milligrams. Alprazolam and diazepam comes either, I think it does come with 10 and 5 milligrams, but typically if we're doing conscious sedation, we'll do 1/4 of a milligram of diazepam. In the beginning of my career, I did do conscious sedation. So the sedation levels, if you are taking a Valium pill, it's just going to relax you. It's not going to make you sleepy, or it's not going to push you in the REM stage of sleep. So that's a Valium. With alprazolam, with diazepam, especially diazepam, we used to use about 0.25 milligrams, and the patient will take it just like any other Valium or any other pill. Typically, you guys take it an hour before, or even the night before, to get a good night's sleep, and then you take it an hour before the appointment. And what that does, it regulates the neurotransmitters in the brain. Because when we are anxious and we are very nervous, the brain starts sending so many pulsating signals to the synapses of the neurons because we're so anxious, like something's going on. And then that's going to increase the heart rate, cortisol levels, blood pressure goes up, the sugar drops. And what the Valium, alprazolam, diazepam does, it blocks. It's a neurotransmitter which blocks the firing of the brain, sending all that nervous, anxious signals, and you guys will react on it. So that's the first level, which is just taking, like I said, a pill will be titrated. You take it the night before, and then we'll titrate it through the appointment. You guys are required to come in for your appointment with the bottle of pills, so we can titrate it depending on the anxiety level. It really doesn't have to do much with age, weight, size, male, female, gender. Everybody reacts differently depending on how you break the chemical and depending on the receptors in the brain that's going to get the chemical to calm down that kind of fire. I call it monkey brain, which is like your brain going all over the place, just getting really, really anxious. So that's the other one. We sometimes, for conscious sedation, we will titrate the diazepam a lot more frequently, almost every half an hour, until we get you to the sedation level that will or the calmness that we require in order to get the treatment done. Sometimes we'll combine Valium with nitrous depending on the condition and the level of the nervousness or the anxiety. We'll combine with the nitrous, just the nitrous will take the edge off. And it's almost what nitrous does. It actually will relax you so the Valium can kick in, because a lot of you come in taking Valium, it's like, I'm still anxious. You're firing so many different questions, and we can tell your pulse is high, and we can tell that you're not at the calm level that we can kind of deep breathing, belly breathing, kind of reaction that we would like to see in order we start, because we're going to give you also Novocaine. Novocaine has epi, and epi can make your anxiety even worse. The third type of sedation, so the first one is just a pill. Second one, you can combine the valium with nitrous. The third type of sedation, IV sedation. IV sedation, obviously, you're under to a certain level of consciousness, and then that has to be done with a proper setup that you will get the IV sedation and then also the antidote to wake you up, and also hydration, and you have to monitor your pulse, you have to monitor, you're hooked up to a pulsometer, and then also a blood pressure cuff just to make sure you're monitored through the whole appointment. So I hope that clarifies the different types of sedation in dentistry, that as far as I know. And many might have other, chemicals or techniques that they use in their office. So don't feel embarrassed or don't feel that you should not ask about it. It's very important, I think, for your provider to know your anxiety level and how high it is in order to manage it and navigate through it for the procedure so you can get stuff done. All right, that's it for today. Again, I hope this helped you guys. If you have any questions, again, you're more than welcome to call us or just leave me a comment on the video. I'll be very happy to answer it. We love you. Be safe, and DS out.